Well, patients with BPH, or benign prostate hypertrophy, an overgrown prostate, have problems with the way they urinate. It can be manifesting in a variety of different ways: urgency to urinate, trouble sleeping or sleepless nights, a weak force of stream, or maybe just simple practical things like I always have to stay on the aisle seat when I fly, or I can't make it through a movie without getting up to go to the bathroom.
My prostate issues were impacting my life in that I was getting up more at night, and then when I would travel, I'd be in an airplane, and as soon as I'd have to go to the restroom, the pilot would turn the no seatbelt sign on, and then I couldn't get up. Then I get worried about it. And then at work in the office, I noticed I had to void my bladder more often, and that was kind of annoying.
Well, the prostate, first of all, is a fertility gland. It's a walnut-sized shaped gland that sits underneath the bladder. And as we men get older, it not only grows outwardly, but chokes off the urethra inwardly. That causes you to be able to pass your urine with a restriction.
I first started with some medication to relieve my symptoms of my prostate. I took an alpha blocker. That helped a little bit. But then Dr. Butler did a tuna procedure, which is transurethral needle ablation. It just means putting heat in there, shrinking some of the tissue. So that was my first procedure. The tuna procedure made my symptoms almost disappear. They went away a lot. But after several years, the tissue started to grow back, and then I knew I had to get something done again.
Well, the Urolift is a special type of procedure where instead of a surgery that cuts out prostate, ablates prostate, heats prostate, vaporizes prostate, we now have a way of just separating the tissue by little mini implants which hold it open, much like sliding a curtain on a curtain rod and keeping it open. So it's a mechanical therapy that works wonders for opening up the channel.
But the recovery was much quicker than the tuna. Within a day or two, I was back to normal activities, where the tuna procedure took several days, really.
Well, the Urolift, I now describe it as a game changer. In many cases, patients can get completely off medications and avoid surgical techniques that might require time off work or hospitalization. The benefit of the Urolift can be summed up in that it can sometimes and most often be done in the office setting in less than an hour, to have quick recover back to full activity within just a few weeks, to have maybe no catheterization at all, and to have minimal side effects.